morning and welcome to another episode of Ask the Doctor on Great Expectations. We've all heard about uterine fibroids, but what is it exactly? Well, today's show aims to unpack all the facts that you need to know about uterine fibroids. We welcome in studio today Dr. Gary Sudwarts, who is a radiologist with a special interest in fibroid treatment, and gynecologist Dr. Corne Brink. We also have panel mums Tilly Rangododo and Bernadette Chiponda, who are currently battling with uterine fibroids. Welcome. Thank you for joining us, everybody who's come in today. We'll start with you, Gary. You have a special interest in this. Simply, what are uterine fibroids?
Well, fibroids are benign growths. They're not cancerous, as you understand cancer, of the uterine muscle. And they can grow very, very large. Usually they're quite small and they don't really cause us a problem. As they get bigger, and depending on their location within the uterus, they cause the symptoms of fibroids, which we'll discuss.
How common are they, Corne?
Uterine fibroids can be quite common. If we look at studies where they did hysterectomies for women for unrelated conditions, it's fairly common, but they're not always symptomatic. So although a lot of women will have them, many of them won't complain because of them.
What causes them?
We still don't know. And at this stage, we think there's some genetic reason for it, and combined with then some environmental factors contributing, things like hormones, certain meats, certain age where women start having periods that contribute, but we still don't know why.
Tilly, tell us your story.
I'm not really sure when it started or how it started, like she said, what caused it. But I started having heavy periods and cramps. So then I went to the doctor, and because at first I thought I was pregnant, then I realized I'm not, because I'm still getting my periods. Yeah. So she said she suspected I had fibroid. But having never heard of fibroid, I actually didn't take it into consideration. I was like, oh, okay, maybe it's just something that's caused by injection or pills. So I decided to stop taking the injection because I thought that's what was causing it. Then it didn't stop, because then from the injection I went on to the pill.
Now, how long ago is this?
Last year.
Last year, okay.
July, August.
Okay.
So when it didn't stop, because I stopped using the injection and I went on the pill, I went back to the doctor again. And she said, Tilly, I don't think this is anything to do with the injection or the pill.
Yeah.
Like I said, it's a fibroid. So then I went, she sent me to a gynae. And then that's when the gynae told me, well, you're already pregnant and you've got a fibroid.
And were you panicking at that stage?
Yeah, because I think I should have read or asked about fibroid what they were, but I didn't.
So what was the advice you got? I mean, you can have your baby and the fibroid is there and it'll be okay? What did they
actually
say?
He did tell, the first doctor told me, even the gynae told me, look, rather focus on the fibroid before you fall pregnant, but also you can fall pregnant with a fibroid, but you can miscarry, or or you might not carry up to term. You might have a preem baby, which is what I had. I had a preem baby. So I decided to go against them because I thought, let me have the baby now. Let me try and have the baby now. In case if I can't have babies, then, already I've got a baby. If any of those things happen, I'll just deal with them.
Yeah. So, okay. So you didn't want to fiddle with what was going to be going. All right. Bernadette, your story. I mean, you had surgery recently. What was it like? How are you feeling, firstly?
Okay, because of the two procedures that I had, I think I'm recovering much better.
You look great.
Thank you. I think I'm recovering much better, but initially when I discovered that I had the fibroids, the options that were given to me were very daunting, very scary. I'd just been married a year. My husband and I were trying to have children. All I realized was that I'm gaining weight and I'm bleeding more. And those were not symptoms of pregnancy. So when I went in to the gynae, I was then told that I've got fibroids. But in my case, they were everywhere. It's not just a single one.
Was it painful? Were the fibroids painful in your case?
Yes, they started to be painful.
Okay.
Especially towards the operation, towards finding out about Dr. Gary. It became very painful. I was anemic. I would have migraines at work, things that I normally wouldn't usually have.
Yeah, you wouldn't expect to, get a headache from.
Precisely. So when I went to the different gynaes, I wasn't one to settle for one. I wanted different opinions, so I went to the first gynae. They told me I've got uterine fibroid, but they didn't tell me the extent. They just said, wow, your womb is full.
Oh, goodness, you must have been petrified.
Then I was petrified, and I said, what is this thing? Okay, so I went for a second opinion, and then that doctor, the gynae, said, you know, the only option would be to have a hysterectomy. And hysterectomy was not even in the question for me. I just got married and I wanted to have children. So what I did was I went on the internet, Google, and I just started searching on uterine fibroids. How can I get help on this? And eventually I came across Dr. Gary and his new procedure, the UFE, and we took it from there.
And they're all out now?
They're all out.
All right.
And with minimal bleeding. So
Okay.
I'm glad.
Okay, so those are the two stories we have here. Gary, I first want to talk about, and Corné as well, I want to talk about Tilly's story and going through with having a baby when you've discovered there's a baby and a fibroid in there. I mean, that must be very difficult to live with for all those months as well.
I think for the mother, it's quite a scary thing to understand that there's something that might jeopardize her pregnancy. If you go onto Google, you might read about premature delivery, malpresentation, breech presentations, bleeding at the time of delivery, all those scary things that we sometimes see linked to fibroids. Fortunately, from where we're sitting, we see them very seldom.
Okay.
And most fibroids will either go almost undiagnosed during pregnancy or not cause any issues. And from what I gather, that's what Tilly went through is fairly straightforward, easy pregnancy.
Well, her baby came a bit early.
Okay.
Is that always the case?
No,
Sometimes
that would
it's
not
full
always
term?
be. Very often they can go full term and not have any complications related to the fibroid per se.
All right. Gary, who is more at risk of developing fibroids?
So it's definitely hormonally responsive. So we're seeing women, into their late 20s and 30s that they first come with the symptoms of the fibroids. It'll also be the time that they go to a gynecologist for whatever reason, they're pregnant or they just want to check up. Gynecologist does a scan and sees the fibroids. And as they progress, as they get older, the fibroids will grow. And when it reaches a critical size, depending on where they're located, they'll present with symptoms. And this simply those symptoms would take time to develop.
All right, that's just the start of our discussion. Well, it's time now for our weekly Pampers Monday Minute. And today we learn about the importance of exposing baby to the sun at the right time for the safe production of vitamin D.
Moms, there's so much to worry about when it comes to our children being in the sun. But did you know that sunlight is essential for the production of vitamin D? It is recommended that fair-skinned babies receive 10 minutes of sunlight per day and darker-skinned babies approximately 30 minutes in order to produce sufficient levels of vitamin D. But moms, remember that baby skins are soft and delicate and will burn easily in the sun. Therefore, moms, keep babies indoors between 10 in the morning and 3 in the afternoon when the sun rays are at their strongest. Find a balance. Practice sun safety, but also allow your little one to soak up some yummy sun rays in order to produce vitamin D.
More baby care tips on your next Pampers Monday Minute.
Great advice as always from Pampers. After the break, we talk about the symptoms and effects of uterine fibroids. Welcome back to Ask the Doctor on Great Expectations. Well, today we are discussing all the facts about uterine fibroids, a very common condition that many mums actually face. In studio, we have radiologist Dr. Gary Sudwartz and gynecologist Dr. Corné Brink. So with us, we have Bernadette Chiponda, and we now welcome mum Jenny Hammond, who has just undergone treatment for fibroids. Jenny, welcome to the program. We'll get your story from you in just a moment, but first I want to check with Corné, what are the symptoms of uterine fibroids? What's a woman going to feel if she has them?
So as we've mentioned now, that very often women won't even know that they've got fibroids, but the most common presenting symptoms when a woman walks in and they start to talk about their symptoms where we would start to consider fibroids would be mostly very heavy periods, often with that signs and symptoms of anemia. And then sometimes they might complain about pressure symptoms, pressure on either the bladder or the uterus, or their clothes not fitting nicely anymore. And very seldom actually pain, although it's well described. But pain is sort of a late symptom of fibroids.
Okay, when it's been there a long time.
Absolutely.
Do they, Gary, can they disappear or shrink by themselves, or do you always need some kind of medical intervention?
Well, as Corné said, you don't always need to do something. When you do need to do something, when the symptoms become a problem, then they don't go away. They don't disappear, and it's a misconception they should get smaller after menopause. They don't, unfortunately, and if they're very big and the it's pressure related, those symptoms will continue. But in the younger women, it's a progressive thing. They slowly get bigger and bigger and bigger until someone needs to do something about them.
Jenny, in a nutshell, what is your story? We've heard from our other moms.
Yeah, so it's similar to the other ladies, but I think the symptoms are basically how it was with me, is that for a few months you have heavy periods, but it's not every single month. So you don't straight away think there's something wrong. And then you try a different contraceptive, maybe that's what your doctor says, okay, let's change your contraceptive on the hormone thing. And you give that a good 3 or 4 months, but in between you're having your heavy periods. And then by about the 4th, 5th month, you try another contraceptive, and you're still not better. So it's really about 8, 9 months later that you then get referred to your gynae. That
trial and error.
Yeah, trial and error.
Now you found out you had fibroids after you had a child.
Yes.
You
My
have
son,
one
I have one son, he's 11, so I was just having these heavy periods trying to correct it with the pill, and by about the 2nd changing of the pill, my doctor said, no, you better go see Dr.
Were you
Brink, your
trying to
gynae.
have another child after him?
No.
Okay, so it had
no.
nothing to do with trying to conceive.
No.
Okay.
Though I did read that it is possible to have, but it's your chances are less. A smaller percentage to fall pregnant, but I think you can also, I read, still have kids.
And what treatment have you undergone?
I had then the uterine embolization, the fibroid embolization that Dr. Gary did.
And you're fit as a fiddle now.
Yeah, I've been, and
Fantastic.
the anemia has been addressed with, because now the actual cause of it has been sorted. So
Okay. Well, before we get to the questions you have, because your next step is to try and have a baby, I want to find out the cravings that they've had, and it had not much to do with pregnancy.
No.
Don't tell me you ate clay as well.
Yes,
Oh my
I did.
goodness. Okay.
Lots and lots of it. So it's all because of the anemia. So the biggest problem with the fibroids is really the symptoms, which for me was restless leg, which is linked to low iron. But I didn't know at the time that was because of the iron. I didn't know then that my iron was so
spinach wouldn't
low.
have gone down too badly, but
You
it has to be
don't?
clay, hey?
Well, I think you're so low, your iron levels are so extreme low that your body, the instinct is that it wants that micronutrients, trace minerals that you find in soil and
Oh my goodness, thank God you didn't eat down somebody's house. Is that common? Is that it's a clay the common
amazed
thing?
at this discussion we had earlier that I mean, one of our patients was actually hiding clay from her husband because she just craved it, and that we can buy it on the corners in South Africa. The traditional
clay
healers
dealers.
are selling it
Clay dealers, all right.
as part of their therapy.
Bernadette, you had some questions about your recovery and conception now. Go for it.
Yes, basically I wanted to find out from Dr. Gary how soon after the procedures that we've done, the embolization and the myomectomy, we can try to start having a child.
Okay, so Bernadette's a special case because she's had both procedures. She had very, very large fibroids. That an embolization we were talking about shrinks the fibroids but doesn't take them out completely.
Okay.
In Bernadette's case, the decision of her gynae was that her best chance for conception is actually removing the fibroids. But doing that alone, just the surgery, wasn't going to be possible because they were so large and so many. So she asked me to intervene to reduce the blood supply. So the question is a little bit complicated in her case. But we'd suggest that she doesn't try to fall pregnant in the next 3 months. And that allows time for the uterus to heal.
Okay.
Because obviously it would be a disaster if the uterus ruptured as it got bigger and bigger with a baby inside.
So, does it seem like fibroids lead to infertility or can cause some type of infertility?
Sure, Corné can answer that, I'm sure.
It's definitely one of the causes. They suspect about 1 to 2% of women suffering from
Temporary?
infertility. Depending, because firstly the fibroid, the mass of the fibroid can occlude the tube that's got to carry the egg to the uterine cavity. And that would be permanent until that's been addressed then. And secondly, it does seem to interfere sometimes, especially if it's close to the endometrial cavity itself, with implantation of a pregnancy and so forth. So not only causing infertility, but also very often early miscarriages for some women. But it's not that common though.
Okay, are you worried that your fibroid might come back?
It is it's one of my greatest concerns, and I keep asking myself the question, what do I do to avoid it? because I don't want it to come back.
Can you avoid it?
So
Can
it's
you?
a difficult path a lot of our patients have is that they've had, they get diagnosed early, particularly in young black women, and they get surgery and only to find they need further surgery in 5 or 6 years' time, and that's quite a complicated situation, going back in and doing surgery again. And the fibroids, as we said, that they're hormonally responsive, and it's not that they're new fibroids that develop, it's the old ones that we couldn't see or feel that's continued to grow and weren't removed
Giving
the
them the
first time.
space to grow now.
Right,
All
so it takes the time to grow.
Okay, well, we say goodbye to you, Bernadette, and thank you very much for coming on to share your story. Hopefully we'll have you back on our Preggy show in a couple of months. That'll be fantastic. After the break, we talk about treatment options for uterine fibroids. Welcome back to Ask the Doctor on Great Expectations. Today's topic is uterine fibroids. If treatment for uterine fibroids is required, both surgical and medical treatment options are available. To give us all of the information about the treatment, we have radiologist Dr. Gary Sadwarts, who has a special interest in fibroid treatment, and gynecologist Dr. Corne Brink here with us. We also have in studio panel mums Jenny Hammond, and we welcome back Tilly Ranjororo. What are the treatment options? Let's just break it down simply.
So in simple terms, there'd be the medical treatment you mentioned, which is pills, tablets, there'll be hormones, or you might treat the anemia with iron supplements or just painkillers, Panados and Brufen and so on. They would go on to surgical treatments, which would be either open or closed, keyhole surgery, or actually open surgery of removing the fibroids. Then there's another option, which is called an embolization, whereby the radiologist gets into the arteries that supply the fibroids. It's quite sort of clever technique to block the blood supplies using tiny little particles. And then the final option, which unfortunately is very commonly performed in South Africa, is a hysterectomy, which is removal of the uterus itself.
When do you actually, at what point would you say, okay, this is the only thing we can do for you now?
Sure, it depends obviously on the size of the uterus. So all of those other treatment options might still leave you with a bulky big uterus, and if that's the cause of the symptoms, bladder pressure or pressure on the rectum or so on, then you might choose that. If you're worried about cancer, there's any reason to worry about cancer either because of the imaging, so the ultrasound or the MRI, or family history, then you might want to, because that's the only way you're really going to get tissue and send it away. But unfortunately, hysterectomy is also what's available to most women in South Africa, rather than the other treatment options which require specialized techniques.
If, like in Tilly's case, you have you're having a baby and there's a fibroid, what's the safety issues? Are you treating the fibroid? Are you taking medication at that point while you're pregnant?
Not at all, not during pregnancy. We will deal with symptoms related to fibroids in pregnancy as they come up. And one of the, well, not that common, but things that we do see is where, because the fibroid and the placenta is basically fighting for blood supply, often, or always, the placenta will win and the fibroid will lose its blood supply, and we call that red degeneration. And that can present almost like a burst appendix in pregnancy. And the difficulty then is to diagnose it correctly and to just manage the woman with pain meds for the few days. So often 3 to 5 days with some hectic pain medications, and then they should be fine. Absolutely.
Okay. Well, Tilly, you still have the fibroid. You've had your baby, but you still have the fibroid. What are your concerns now? What do you need to know?
I guess I wasn't sure whether I can remove it, and if I do remove it, when do I remove it, since I've had the baby already?
Obviously, she will need to be checked, and we need to see where this fibroid is sitting and how much of the uterus is affected by it. The fact that she did have a very successful, healthy pregnancy already is a good sign. And I think many will differ from me there, but I would say leave it as is, have your babies, and then look at when your symptoms are
So if she wants to have another baby now,
if it's not somewhere close to the cavity of the uterus or where it's going to affect the pregnancy directly, I would be comfortable for her to try and fall pregnant rather than scar the uterus, cause adhesions in the pelvis, or do any of those things that can have a negative effect also on the pregnancy.
All right. Is surgery guaranteed to sort the problem out?
So unfortunately, there are no guarantees in medicine. We talk about chances and our best approach, and then we discussed openly with the patient what she can expect. And then we start comparing options, with the least invasion going to the most invasive and what's the most likely best outcome. So unfortunately there aren't guarantees. But what we generally find is that if women are having their fibroids having to need treatment very early in their late 20s, they're generally going to come back to us for another therapy of sorts. If they're coming in later on, then may just be the one.
So do you advise how often that they should come back for a checkup to see if they're back or not?
I think it again depends on the woman's symptoms.
But like we said, sometimes they don't have
absolutely.
symptoms. So every 5 years, maybe every 10 years.
Or the moment that their periods do get heavy again, or they want to fall pregnant and they are concerned about fibroids being playing a role in not falling pregnant.
We should be seeing our gynae every year anyway, right?
Absolutely, but to do an ultrasound's not always necessary.
Not always necessary. All right. Jenny, I mean, just your experience after, your lifestyle changes after having the surgery, and just your advice for other women out there.
It was really big, the changes, because anyone that's suffering from fibroids will tell you that the heavy periods is debilitating, and it carries on for much longer than your normal period would be. So you've got to always keep that in mind wherever you go, whatever you do, because you've got to be prepared. So you're reluctant to do a lot of things, general things, like it could be going on a extended boat ride or something that you would say, no, I actually can't go, but you can't say why or whatever, So in your daily life, just little outings that you'd have to be careful about. And then exercise-wise, energy, once the anemia was sorted out, that was amazing how much more energy you had.
We're almost at the end. Very quickly for us, in a few seconds. Can fibroids be prevented?
Unfortunately, no. There's no way to stop them from forming. We know that there's genetic predominance and some dietary issues, but unfortunately, if they're going to happen, they're going to happen.
All right. Well, most of the time, uterine fibroids do not cause symptoms or problems, as we heard, and a woman with a fibroid is usually unaware that it is actually there. Mums, it's important to always be informed so that detection and treatment are possible. Now, join us tomorrow on Great Expectations as we celebrate Heritage Day. We talk about the heritage we share as South Africans and the things that make us unique.
Don't be shy now, sing along. Sing the Cinderella, sing the Cinderella, sing the Cinderella.
Well, thank you to our wonderful experts and our panel mums for sharing your experiences with us, and thank you at home for watching. Goodbye, and remember, you're great parents.